recently shared this video about Texas delaying the release of the mandatory maternal mortality rate data and won't be ready for Texas lawmakers in time for 2023. This is the first time that a state report detailing the latest data on how many Texans die as a result of pregnancy and childbirth will be delayed. It would have been the fourth set of data since 2014 and would have run through the year 2019. The reason why this is so important is because Texas has a horrible maternal mortality crisis on their hands. And delaying the release of this data means that lawmakers won't be able to use the analysis until the 2025 legislation cycle, meaning they can't do anything to address the crisis because the data isn't being released. Texas ranks 49th in terms of prenatal care. 23% of women in Texas are uninsured, about double the national rate. A study was also published in July that outlined the maternal morbidity and fetal outcomes among pregnant women at 22 weeks gestation or less with complications in Texas hospitals. In these cases, Texas hospitals are under state-mandated expectant management, meaning that unless a patient is actively dying, they are not allowed to induce an abortion. Though this study was a small sample size, it is indicative of the kind of changes in maternal health outcomes we can expect to see with these types of bans. Expectant management resulted in 57% of patients having a serious maternal morbidity compared with 33% who are able to get the care that they need. Of the 28 cases, they were finally able to get care when they had an infection, 10 of them. 8 of them went into spontaneous labor on their own, and 9 of them had to wait until their fetus died. Of the 8 infants that were born, 7 died within 24 hours and 1 remains hospitalized. Maternal morbidity, including conditions such as clinical chorioamnionitis, which is an infection of the amniotic sac, and hemorrhage, occurred in 12 of the 28 patients, and 9 of them required intensive care admission, dilation and curettage, a DNC, or readmission into the hospital. 1 patient required a hysterectomy. We can wait for the data to be published, but it is also very clear how harmful these bans are, and how harmful it is when people are actively being denied life-saving reproductive health care.